Hi, you've all heard of self-breast examination. What is it? How do you do it? Self-breast examination is exactly what the name implies. It means that you are examining your own breasts to see what's different. You've often heard, go to the doctor if you think that something's different. Well, how are you going to know that something's different if you don't know what's normal for you? So let's find out how you go about finding that out. This is not a sexual thing. It is very much part of your breast health. The purpose of doing it is to see, do you have a lump? Do you have any changes in your breast that might signal that, oh, this could be maybe something that could be related to breast cancer. So we want to find it out early so that we can see our doctor and get on it. So before we do this, it's important to understand where your breast tissue is. Obviously, we have the mounds, everybody knows that. But know that your breast tissue, when you're examining, you want to go up to your clavicle, so that's your collarbone. And you want to make sure that you go into your armpit because breast tissue extends laterally into your armpit. And quite often, breast cancer will be in the lateral part. Obviously, you want to make sure you go inferiorly, even just under the breast tissue. So we're told to do this when you're laying down, when you're standing up, and when you're in the shower. So you're going to be laying down and you want to make sure that whatever amount of breast tissue you have, that it is flat. Don't overthink this. You're going to go out there, don't try to read and find a process. The purpose of this really is to know what your normal is. So what you want to do is make sure that you're using flat fingers because you don't want to feel by like digging into your breast tissue. You want to use the pads of your fingers, at least 3 fingers. And you want to make sure that you're going in a circular pattern. Start from the center and light pressure all the way out. Make sure that you're going all the way up to the clavicle. Make sure you go into your armpit. Soft pressure first, and then after that, you're going to go a little firmer. After you do it laying down, the next thing you're going to do is rise and shine. You get up. What do you do usually in the morning? Most of us go and take a shower to start your day. But before you go into the shower, on your way to the bathroom, you're going to pause, take a second, and look in the mirror. You're looking at the size of your breasts. One's often going to be either smaller or larger than the other. It might be a very subtle difference, and for some people may be a bigger difference, but that is your norm. Are there any rashes? Are there any indentations or dimpling, discoloration? Is there any bleeding? Is there any discharge that you're seeing from your nipple that's spontaneous, meaning that you're not squeezing it out, it's just spontaneous? You know, sometimes you hear people that get up and say, oh, I see like some red on my nightgown. Well, is there anything that you're seeing on your nipple that might signal that you have some discharge? So I want you to grab an object. I have an orange here and feel it. The orange is dry. The orange is your breast. It's your skin. And you can still feel things in there, but there's a bit of friction. Now I want you to try it with your hands wet. See how it glides easier and you can feel things a lot easier. So if this is on your skin is wet while you're in the shower, your hands are wet while you're in the shower, and it's just going to be a lot easier to feel if there is a subtle lump or indentation in the breast tissue, and that's why we say to do it while you're in the shower. Now, you're done. I'm going to recap. You want to do this when the breast is flat. When you're laying down, you're making sure you're feeling to the clavicle, into the armpit, laying down, standing up, looking in the mirror, arms up, arms at your waist, flexed. You want to also make sure that you look when you're bent over, looking for any indentations. After that, you're going to go into the shower. What are you doing when you're in the shower? You're going to do the same thing that you did before you got into the shower. Nothing different. And that's it. Now let's talk about when to do this. Don't get hung up on, oh, I've got to do it at the 1st of the month or the 3rd or the 5th. Pick a day. It's just easier to do it if it's the same time. But as long as you do it every month, that's good. Let's not complicate things, okay? So you've done all this and things are either good, so yay, or you see a lump. Now, remember, not every lump is breast cancer. It could be a cyst, but you don't know. What we don't want to do is find a lump and then be like, well, I'll just sit on it. Go see your doctor, get a requisition for an ultrasound or a mammogram, depending on your age. Your primary care physicians are awesome. They're going to guide you the best way to go. And you're going to come to the radiologist and we're going to look at you and take it from there. What I can promise you is that we got you.